So for my respiratory condition, I decided to do pneumonia. Pneumonia is a inflammation of the lungs, and it can be caused by any sort of bacterial, viral, or a fungal agent. The most common is bacterial pneumonia, and it's often caused by Streptococcus pneumoniae bacterium. There's actually vaccines for pneumonia now. In adults over 50, there are 2 different vaccines you can get annually, and they will hopefully prevent it for you. Pneumonia is also a very deadly disease and has a very high mortality rate, especially in other countries. Sometimes it's the leading cause of death in some countries. But on the pathophysiology side of pneumonia, it makes the alveoli vulnerable to a lot of disorders. They can collapse from obstruction somewhere in the proximal areas or from external pressure. Some of those conditions can be a pneumothorax, a hemothorax. They'll fill the alveoli with pus and blood. Under normal conditions, most of the air that goes in and out of the lungs is like 79% inert gas, nitrogen, which keeps the alveoli open. If the patient's given 100% oxygen, like we always do, then the alveoli becomes plugged and collapses. So this is one of those times where being given oxygen 100% isn't always the good thing. Patients receiving high concentrations of oxygen are at an increased risk of atelectasis. The human body, we have billions of alveoli. Remember the little tree? You have all the little leaves. It'll have billions and billions of alveoli. And it's very common for them to just collapse sometimes when you cough, sneeze, something like that, change positions. But it's not a very big deal. When you have pneumonia, they fill up with all this kind of liquid, either blood, pus, some sort of fluid, and they collapse in masses, and they can't reopen. They're very difficult to blow up once they collapse, and even entire lung segments can collapse at a time. For management of these types of patients with pneumonia, you want to encourage them to cough, take deep breaths, get out of bed. Even if it's painful, it'll help them. Those who can't get out of bed, they can get hypoxic and catch a different lung infection, or get more pneumonia than they already have. Some of the different kinds you can have bilateral pneumonia. It's very uncommon, but most pneumonia settles on one side, one lung, because you typically sleep on one side, so it's going to settle on that side during your sleep. Some of your, signs and symptoms for your pneumonia: you're going to have a productive cough, a fever, it's just a little bit difficulty to breathe, sometimes chest pain with an infection, anything like that. The most thing you can do is just encourage them to take breaths. They have a device they give you at the hospital. I've never seen it in pre-hospital use, that you're supposed to suck on, and it increases resistance and makes you try to inhale and open up those alveoli. They're kind of like balloons. You want to get them back open, even though they're harder to do, even though it might hurt. It actually encourages you to open up those alveoli more than they already are. We can force breathe for them using BVMs if they'll tolerate it. And that's about it. Thank you for watching.